Today we will discuss one of the important topic comes under the family health nursing services, home visit. I am myself Mrs. Savitha, Assistant Professor, Department of Community Health Nursing. Moving on to the learning objectives of today's class, you will at the end of the class you will able to define home visit, discuss the purpose of the home visit, describe the principles and explain the components and phases of home visit, explain the advantages of home visit, and also you can able to explain the role of community health nurse in home nursing. Coming to the introduction says that backbone of the community health nursing. The home visit is a backbone of the community health nursing because in the community health nursing, we provide services to the group of people. It is one of the appropriate approach where you can able to provide services to the group of people. That is why it is called as backbone of community health nursing. The services in the home require, that means that the person who gives or the healthcare provider which provide health services at the home setting, they require to have some technical skill. For example, providing the medication. It may be administration of injection, dressing the wound, etc. And also the person who provides services, they should have the knowledge regarding preventive and therapeutic measures in terms of how to prevent certain epidemics and what are the complications due to some disorders, diseases, and also we have to have the knowledge regarding therapeutic procedure in order to control the disease and prevent complication. That can be educated them and in order to reduce the disease burden in the particular area. And also the person who provides services, they should have the ability to teach them incidentally and planned teaching program, and also they have to have the capacity to judge along with the including the community and the family member. They have to take the appropriate judgment related to the health and disease, and also they have to have the idea of understanding the human relationship, what exists between the family member, between the community, and what type of family relationship they are existing with you. That is also is one of the important aspect where you can able to provide services through the home visit. And moving on to the definition says that it is a process of providing nursing care to the patient or the family at their doorstep. Of course, the people who are trained in a particular health care settings, they will go to their home and they will identify their needs and provide the need-based services to them in their doors, in their family setting. That's why it is called as process of providing nursing care to the patient or the family at their doorstep. Moving on to the purposes, it serves several purposes because one important purposes are to check the living condition of the family. It makes sure that the home is safe and healthy. For example, if the particular family, one person is suffering from the asthma, the healthcare provider will look into the environment around them, and there will be, if there is any dust or the smoke, if such kind of issues noticed, we will provide some education why it has to be cleaned off and why it is important to keep well ventilated environment for the particular patient who are suffering from the asthma. That opportunity which gives us. And another second one is to give care and support. It helps to give us care. Suppose, for example, when the medical help in terms of patient is having the wound, we could able to dress the wound, and also we can able to teach them regarding that wound dressing and how to give some comfort position to the patient also can be advised, and also meanwhile we can able to reduce their tension and emotional support also can be provided through the home visit. And the third important purpose is to understand the family situation, including relationship. First of all, what kind of relationship exists between the family member and what are their needs, what are their problems can be identified through while giving the services through the home visit. And the fourth one is to follow up and monitor the progress. It is nothing but making sure the plan or the treatment are being followed. Usually we will give the advice, we will teach them something related to health and well-being, all those things, whether they are following it or not, that can be observed through the follow-up and monitoring process. This is also will be the one of the important purpose of the home visit. And moving on to the principles of the home visit, there are 5 important principles. One is planned. It is always the home visit is a planned activity. Why? Because whenever the professional or the nurse will go for the provide services through the home visit, they have to have idea about the geographical area of that particular region, as well as the houses, what kind of house it is, what type of family it is, and what are the age groups prevail in the particular area, what is the prevalent disease condition. Everything need to be understood before you go and give the services to the patient through the home visit. That's why it is called as a planned. When you collect the preliminary assessment, when you do the preliminary assessment, you could able to understand what is the structure of the particular area, and you could very well able to plan the activity and develop an objective, and also you could able to assess the objective at the end of your home visit, whether you have met or not. That is the one of the principles you need to follow, that is planning. Another one is need based. Whenever you do the preliminary survey, you have to develop a list of problem which is associated with the family, and also it has to be listed, and based on that objective will be set and plan of action will be set. And once the objective is set and plan of action is set, you have to prioritize that particular needs. That is called as need based assessment and provision of care. That is to be followed as a principle, second principle. And third principle is regular. Always the home visit should be consistent and regular intervals, because you could able to understand the progress of the disease, as well as you can give the follow-up, and even you can give the support and care through the regular visit. That is the third one. And fourth one is flexibility. Always your services will be flexible enough to take care of the health services. Suppose, for example, when you entered at the first day, you might have observed that the one family is having the pregnant lady. You might have developed an health services for in order to take care of that particular lady. But next day when you go to the home, you might have observed one child is suffering from the fever. That in that particular time, your focus will be on the care of the child to reduce the fever. That is nothing but it is a flexibility. You have to, always you have to flexible in your caregiving. And next to the educative in the sense, whenever you give the services, whenever it is required, you find that knowledge gap, you find that there is something is not evident, you have to educate them. Incidentally, planned teaching program, and you have to make aware them all the areas of health related and disease condition. That is one of the important principles you have to follow in home visit. Next, moving on to the components and phases of the home visit, you have to complete your home visit through the 5 phases. One is initial phase. Already we have discussed in the planning, you have to always you have to collect the preliminary survey. You have to do it so that you could able to understand the area of the community. You could understand what is the resources available to them in terms of health, and what is the communication type they are having, what is the traveling transport facilities they are having. Everything you need to understand during the initial phase, and also during the initial phase you have to go to the each house and assess the basic requirement of health assessment will be done in terms of checking the BP, in terms of recording the GRBS, in terms of giving adherence to the advice to adherence to the medication. Everything you need to do it superficially so that you gain the confidence, you will develop an comfort, you will develop an good relationship with the family member. That is nothing but it is an initial phase. And the second phase where you can able, that is free visit activity. Once you collect all the data, you need to organize the data, analyze the data, and you have to list it down, all the activities, all the problem which you encountered during the initial phase, and you have to develop an objective, you have to develop an care plan, and once you develop an objective and care plan, you have to prioritize. And also before the visit you have to inform to the each family member your visit will be occurring. That is second component, second phase of home visit. And third phase, in the activity during the home visit, whatever the activity you have planned during your pre-activity visits or the activity time, that is to be implemented completely based on the needs, and then you have to record everything in your document everything in your record, and also it has to be during the activity involve the family member. Because for example, when you wanted to give some sponge bath, you wanted to teach some sponge bath to chronically ill patient, you have to involve the family member and you have to teach them so that they can able to take care effectively in the further days. That is nothing but activity during the home visit. And the fourth phase is the last phase, that is terminal phase, where you can able to say goodbye to the family member. In the sense, you have to recap all the activity whatever you have done during the home visit, and you have to find out if any unresolved problem is there, or any new problem you have identified during your assessment. And also you have to clarify all your doubts in the terminal phase and reschedule your visit, and reschedule your visit and say thanks to them. It is nothing but it is a terminal phase of home visit. And next to the post visit activity, what you will be doing, whenever you complete everything, you have to document in the records. Document should be complete. And after the completion of the document, something you need to present to your supervisor, or you wanted to give the records to the primary health center, you need to do it, and you have to update the file of the client so that for the further treatment. Move on to the advantages of home visit. It is gives us to develop and trust with the clients, because when you have the knowledge regarding basic assessment, so can be done for the people who are there. You could able to record the BP and the GRBS, all those things, the basic requirement. If you are doing effectively, definitely they will accept you and they will develop a good positive relationship with you, and they will accept whatever the advice you have given to them. That is one of the advantage. And another is you could able to offer personalized care. You already know that each individual in the family is differ their health related status, so that you have to assess each and every individual in the family, and you have to develop each and a separate objective and the care plan for each and everyone, and you have to implement effectively so that you could able to give the care personalized way. Another thing is you could save the travel time for the client. Also, in case of people who are suffering from the chronically ill, those who are recovering from the surgery, and elderly person, and those who are mentally and physically they are challenged people, they cannot able to travel from place to the hospital and health center, but for them it is saves travel time, and it will provide comfort to them in terms of receiving services. Helps to observe the living condition. Of course, it gives an opportunity for the healthcare provider to observe living condition of the particular family. It is very, very important. It is very well connected with health and diseases, so that it gives an opportunity to the healthcare provider, and also it improves the client comfort, because you are giving the services at their home settings. Since you are giving the services to their home settings, definitely they are free of tension and anxiety and fear, so that definitely they will be comfortably, they will receive your services. These are all the advantages of home visit. And what are the roles of community health nurse in home nursing? Always when you give the health services, you have to assess each and every individual separately, since you know that it is a unique, each and every individual is unique, so that you have to record it separately. And once again, after the assessment, you have to plan appropriately for the separate plan, separate objective, and also we have to develop an overall objective, so that what you have achieved at the end of your services. And also you can educate the family about the patient care. Suppose in case of patient is chronically ill, bedridden, so that how you could able to take care of that patient also can be educated. Give emotional support to the patient and the family. You can also give support to them in terms of giving all the knowledge and practice which you can able to provide them, so that emotionally they can able to support other family members also and the patient. And coordinate with other healthcare professionals. The nursing care is not only the ultimate. We may require other healthcare professional also to be looked into, so that in case you can able to refer the patient to the healthcare centers, or if it is required, other some health assistance from the primary health center, community health center can be taken into the consideration, and coordinately you can give the health services. That is also possible when you give the health services through the home visit. And maintaining the records and report is very, very important. It is evident for your work done, and it is one of the always you have to complete the records and report whatever you have given the services, and what is the outcome of your services to be written and explained to the concerned authority. And coming to the conclusion, the home visit always it is a planned visit, and it is one of the appropriate approach where you can able to access a group of people and provide the health services. And without home visit, it is definitely it is incomplete health services you will be going to provide in the community. Always you have to provide health services through the home visit. These are the reference. Thank you.